Hello and welcome to the first video of our Medicare Made Easy video series. We're going to be taking a look at some of the main questions and topics that everyone has when approaching Medicare and getting enrolled for the first time. So the main questions that we get are: what is Medicare? When do I get it, and how do I get it? So we're going to focus on that first question here in this video and do an overview of what is Medicare, how much does it cost, and some of the cost sharing measures in it. And so we're going to start off with an overview of what's called Original Medicare. So there are two main parts to Original Medicare, Part A and Part B. So Part A covers hospital, skilled nursing facility, hospice, and home health services. Part B covers outpatient and professional services, such as those provided by a doctor or non-physician professional, clinical lab services, durable medical equipment, and other medical services. Examples of Part B services are physical therapy, preventive services, mental health, etc. These two parts are paid for in two very different ways. And before we get into the premiums themselves, I do want to note for everyone listening that it's really important that we state Medicare policies are strictly individual policies. Unlike the traditional health insurance market where you can be on a policy with a spouse or a family or a group policy with an employer, Medicare policies are strictly individual policies. And so the premiums that we're going to go over are per person and per beneficiary. Very important that we state that. And so for Part A, the premium is $0 per month if you or a spouse worked and paid taxes for at least 40 quarters or 10 years. This is going to apply to the vast majority of people enrolled in Medicare. However, if you or a spouse did not meet these work requirements, if you or a spouse worked 30 to 39 quarters, that premium rises to $252 per month. And again, that's per beneficiary. Very important that we are adamant with that. If you or your spouse worked less than 30 quarters, that premium rises to $458 per month per beneficiary. Part B, that premium is much different than Part A and how it is calculated. So Part B's premium is dependent on your adjusted gross income from 2 years ago. And so it's important that you keep track of your income as you are transitioning from working to retirement and being on Medicare, because the income that you have is going to determine your Part B premium. And so it's important that, you make sure you're keeping track of what income bracket you're going to fall into, and so you can budget accordingly for your Part B premium. Again, these monthly prices are per beneficiary. So the first income bracket, $87,000 or less for an individual, or $174,000 for a joint filing. This is the main bracket that the vast majority of enrollees in Medicare are going to be in. And so that premium is $144.60 per month. And again, that's per beneficiary. So that's going to be what most enrollees in Medicare are going to fall under. And that's the standard Part B premium for 2020. There are obviously additional income brackets as we move up the ladder. They go all the way up to $500,000 or more for an individual, or $750,000 or more for a joint filing. In that case, you would have a Part B premium of $491.60 per month. Jumping down here to the cost sharing measures of Part A and Part B. So cost sharing is essentially, hey, when the insurance, when it's time to use it, when you have a health issue, what can you expect to contribute towards that purchase of health services? And so we're going to start off here with Part A, an inpatient hospital stay. The first thing that you'd be required to pay is the deductible. Just like an auto insurance policy or a home insurance policy, there is a deductible with your Part A of $1,408. So that deductible, just like auto or home insurance, that deductible has to be paid before any insurance is going to kick in. And so very important that you plan for that. The deductible is $1,408 per annual benefit period. After that deductible is paid, the day 1 through 60 that you're in the hospital, you're responsible for just a $0 coinsurance, so you're not paying anything out of pocket for each annual benefit period. So the first 60 days in the hospital, you are fully covered. Days 61 through 90, however, that changes pretty dramatically. It goes up to $352 coinsurance per day for each annual benefit period. And then days 91 and beyond, you're up to $704 coinsurance per each lifetime reserve day after day 90 for each annual benefit period. And you only have up to 60 days of these reserve days over your entire lifetime. So really important that you keep track of them because once we get beyond these lifetime reserve days, you are responsible for all costs. There is no coverage for Part A. You are responsible for all the costs after that. So very important to note that, yeah, once we get to a lengthy hospital stay, there can be some substantial costs that you would incur out of pocket. Part A, skilled nursing facility stay. So you would pay for days 1 through 20 a $0 coinsurance for each benefit period. Days 21 through 100, you'd be responsible for a $176 coinsurance per day of each benefit period. And then days 101 and beyond, you are responsible for all costs. For Part A, home health care. You would typically pay for home health care $0 for home health care services. The only expense that you would have as a beneficiary is 20% of the Medicare approved amount for durable medical equipment. And so if there would be equipment that would be needed to be brought to your house by the medical professional in order to help you perform certain functions or activities, you'd be responsible for 20% of that Medicare approved amount. Part A, hospice. You typically pay $0 for hospice care. Exceptions for certain pain relief drugs, respite care, and room and board when you are at home or another facility where you live, like a nursing home. Part B, your deductible, like in Part A, there is a deductible that has to be paid before the insurance kicks in. That deductible for 2020 is $198. After that deductible is met, your coinsurance is typically 20% of the Medicare approved amount for most doctor services, outpatient therapy, durable medical equipment, etc. Last thing we want to note for Parts A and Parts B is that original Medicare Parts A and Parts B do not cover prescription drugs. Coverage for prescription drugs must be obtained with a standalone prescription drug plan, or what we'll refer to in future videos as a PDP, or included in a Medicare Advantage policy, and we will go through that as well. And so that's kind of a wrap-up of what the main parts, Part A and Part B, cover and how they are paid for. We're going to jump over here to Medicare Supplement versus Medicare Advantage. So if you are about to be a new enrollee in Medicare, you've probably heard Medicare Supplement and Medicare Advantage 100,000 times in the last 3 years, from people sending you stuff in the mail, trying to sell you Medicare, to what you see on TV or on the internet or in the newspaper. You've probably heard these terms many, many times. And so Medicare Supplement and Medicare Advantage are additional coverage options that the vast majority of Medicare enrollees purchase in addition to Parts A and Parts B, or in place of. And so they do that. So the vast majority of beneficiaries purchase additional coverage through private carriers, because Medicare Supplement and Medicare Advantage are only sold through private carriers, because having only original Medicare does not cover everything. It could mean large out-of-pocket expenditures for certain events, such as a lengthy hospital stay. As we noted on the previous page, if you're in the hospital for over 3 months, you're going to be paying a large amount of money out of pocket. And if you're responsible for all of the costs after days 100 and so on, you're going to be paying a lot of money very quickly. And so we want to make sure that we have thought through all the options for how to pay for that, as well as prescription drugs. Now, because I noted on the bottom of the previous page, Parts A and Parts B do not cover prescription drugs. So the two routes to go are Medicare Supplement or Medicare Advantage. And kind of below is a chart for how they work in conjunction with original Medicare. And so there are only two options. Really, we want to make sure everyone's aware of this. You can only pick one of the options. You cannot pick both of these. You cannot be enrolled in these simultaneously. You can't choose a Medicare Advantage plan and a Medicare Supplement plan. They will not allow you to do that. You must be one or the other. And so Medicare Supplement is something that works in coordination with original Medicare. So it's original Medicare plus a Medicare Supplement, and then a standalone prescription drug plan. So it's kind of a three-pronged tool. So Medicare Supplement options do not include drug coverage, so that's something that must be purchased through a prescription drug plan separately. And then there's Medicare Advantage, often referred to as Medicare Part C. This is kind of an encompassing option of all of these factors on the left of original Medicare, Medicare Supplement, and standalone prescription drug plan. Factors of all of those are included in a Medicare Advantage plan. And Medicare Advantage plan essentially replaces original Medicare and has other options and features in it. So it is an option in of itself. And so again, you can only choose one of these options. And so, really important to note here, I want to go over this sentence. You must be eligible for Part A and enrolled in Part B before you may purchase either of these products, either of these options. You got to have Part A and Part B down before we go and choose one of these if you'd like to. So very important that we get the timing right. Medicare is very finicky with timing. We got to make sure we have things lined up the right way. So we're going to start here with Medicare Supplement. Medicare Supplement, or Medigap, as it's often referred to, is not an insurance policy itself. It is a plan that helps a beneficiary pay various out-of-pocket expenditures that original Medicare does not cover, such as deductibles, copays, coinsurance, etc. Some plans cover more options than others and are therefore a higher premium. If any or all of these apply to you, a Medigap plan may be the best fit for you. You are a frequent traveler. You like paying a higher upfront premium, but then when you go to use the healthcare system, you have little or no out-of-pocket expense. You see doctors or use the healthcare system frequently throughout the year, or you have a serious underlying or ongoing health condition or issue. Very, very important note that we want to make sure everyone is fully aware of, because it might be the most important thing about Medigap, is that the very important thing to note is medical underwriting. So if you wish to enroll in a Medigap plan when you are first eligible for Medicare, there is no medical underwriting. It is a guaranteed issue policy. If you are going to go with Medigap, you should do it right away when you're eligible. If you would choose a Medicare Advantage plan at first and then want to switch to Medigap in the future, you would need to undergo medical underwriting, and it could cause you to pay higher premiums. So to sum it up, if you're going to go with Medigap, you got to do it right away, right when you're first eligible. It's a guaranteed issue. You can't be denied. That is the time to do it. So premiums for Medicare Supplement or Medigap options can range from about $40 to $60 per month for lower end plans to about $100 to $130 per month for more robust options. But rates can vary based on available providers in your zip code. Really important to note that. And again, Medigap plans do not come with a prescription drug plan included. A PDP would be an additional separate policy that works in coordination with Medigap and original Medicare. Jumping down to Medicare Advantage. Medicare Advantage plan, unlike Medigap, is an actual insurance policy itself, and it works as a replacement for original Medicare. However, really important to note, your original Medicare Part B premium still applies to you. You still have to pay it. And so very important to note that. By law, a Medicare Advantage plan has to have at least as good of benefits and cost sharing structures as original Medicare. This policy is similar to a standard health insurance policy, as it contains deductibles, copays, coinsurance, and a maximum out-of-pocket. As a result of having these cost-sharing provisions, the premiums for themselves are often very low, and many plans are available even at $0 per month in premium. If any or all of these apply to you, a Medicare Advantage plan may be the best fit for you. You like accessing doctors and hospitals in a specific network near you. You are in fairly good health and do not use the healthcare system or see doctors very frequently, or you like a $0 monthly premium and don't mind having cost sharing at the point of purchase for health services. Really important to know in terms of eligibility, Medicare Advantage plans must enroll any eligible beneficiary who applies, regardless of health status. The only exception for health status is end-stage renal disease. However, there are special cases when it is allowed. Medicare Advantage plans often include additional benefits that original Medicare does not cover, such as dental, vision, hearing aids, and gym membership. And Medicare Advantage plans automatically have their own prescription drug plan built into them. It is not a separate policy like with the Medigap option. So it's kind of an all-in-one plan. And so it's a little bit more comprehensive than what original Medicare's and Medicare supplement and a prescription drug plan has. And so that is a general overview of the options of original Medicare and the private options that the vast majority of Medicare beneficiaries purchase in addition or in place of original Medicare. And so that is pretty much all we have for you. And stay tuned for our next video. Thank you very much.